Welcome to the CALP series, CVA and COVID-19, Adapting to Challenges in the Field, Practical Ideas for Programme Implementers, which aims to address field practitioners' challenges in relation to CVA programming and COVID-19, and to provide you with practical suggestions you can start using now. In this video, we discuss adapting remote market assessment and monitoring. Remote market assessment and monitoring during COVID-19 have resulted in some significant changes to how we operate in the field. Restrictions on movement. The COVID-19 pandemic is impacting the work of humanitarian organisations. Cash and voucher assistance appears to be one of the most appropriate solutions in this context, but CVA programmes are limited by certain operational issues. Restrictions on movement and social distancing to stop the spread of the disease affect both market assessment and monitoring processes, key components for ensuring effective CVA. Continuing market transactions. While there is restriction on movement and other physical contact, market players such as vendors, including women and men, buyers and consumers, should be able and willing to continue market transactions. Humanitarian organisations, women and other vulnerable groups are facing limited physical access to marketplaces or avoid them altogether due to fear of contamination. They seek alternatives such as stocking up or home deliveries when possible. At the same time, humanitarian organisations must make sure that they frame their response within a market lens and adopt a market-based strategy that can support supply chains where they may be under pressure because of COVID-19 related impact and restrictions. Selecting the appropriate tools. Despite constraints, markets continue to function, and so programmes need to identify and adapt market data collection tools that are suitable within the COVID-19 context, ensuring that we're able to gather data from financial payment services, traders and recipients. Local restrictions and context will inform both the selection and necessary adaptations. Having reached out to various organisations, we have identified two common challenges field practitioners are experiencing. Challenge 1. How have you adapted or plan to adapt to do remote market assessments and monitoring? Challenge 2. What specifically have you done to ensure you're meeting social distancing and hygiene or safety requirements while gathering market information? For each of these challenges, we have solutions being implemented right now. Let's listen to voices from the field respond to the question, how have you adapted for remote market assessment and monitoring?
First, you can use already existing data, such as MEB if they are updated regularly, or any information gathered by local authorities on prices. If you have to gather the information yourself and you already have information on consumer preferences, you can always share online surveys with suppliers. Otherwise, you can check if their supermarkets have online apps for online shopping, and you can check prices there. If there is a needs assessment happening, you can always try to squeeze in some market-relevant questions into the survey, optimizing resources. Lastly, if you know there is another actor planning to do a market assessment or evaluation, why not piggyback and expand the scope?
Great question. CRS and its consortium partners had already established a market monitoring system before COVID-19. However, due to the current COVID-19 situation, we had to adapt to a remote market monitoring system and adjust our scope. Therefore, the following elements were included for the adaptation. The first one is that we focused only on 23 critical markets and 3 critical commodities. The second one is that we have implemented a phone interview for primary data collection instead of in-person market visit. The third one is that we have updated our questionnaire to include questions on policies and restrictions related to COVID-19 that might be impacting vendor operation and households' access to market. And the fourth one is that we have prepared and shared a quick reference guideline for our data senders. Thank you.
WFP Nepal has been regularly monitoring major markets across the country. Due to COVID crisis, we started to assess market situation through telephone survey with higher frequencies and more geographical coverage. We included more commodities of essential food and non-food items and adjusted questions with demand and supply of food and non-food commodities, transportation situation, and labor demand. Moreover, we try to assess the reduced version of Mobile Market Functionality Index, a latest tool developed by WFP. This information helps us understand the overall functioning of markets and provides basis to determine if cash-based transfers are appropriate.
These videos highlight that in the context of COVID-19, to adapt for remote market assessment and monitoring, you need to focus on critical markets and critical commodities, especially those most impacted by supply chain shortages or labour-related impacts of COVID-19. Look for ways to monitor interventions remotely while being sure to gather information from vulnerable groups such as women, elderly persons, persons with disabilities, as well as all who use the market. Collaborate with others and use existing and accessible platforms. By tapping into platforms such as cash working groups and using relevant data from other initiatives and the government. Update questionnaires to give you COVID-19 specific responses by making tools appropriate so that you collect coverage data and other market information such as access, availability, quality. This will help you track social distancing guidelines and other restrictions. Work with local partners. If safe, organise remote interviews or field visits to the market with local partners, traders or community-based organisations. Possible monopoly or market manipulation or dominations by cartels can be monitored through phone interviews and Chamber of Commerce price controls. Again, let's listen to voices from the field, this time for Challenge 2. What are you doing to meet social distancing and hygiene or safety requirements while gathering market information?
En cuanto al monitoreo de programas de transferencias monetarias, ya se hacía bastante por teléfono y se sigue haciendo por teléfono. Antes había además, se complementaba con visitas al nivel de hogar, que ya obviamente se han suspendido, ¿no? Para los mecanismos de quejas y para poder tener un poco de retroalimentación, tenemos línea de atención que ya existía y que siguen funcionando. Lo que sí hemos observado es que muchas más personas que lo usan para solicitar ayuda, más que para retroalimentación sobre los programas, ¿no? Y en cuanto a cómo respetar los requisitos de los donantes, cada organización estuvo negociando con su donante, pero básicamente como seguimos usando los mismos mecanismos de entrega, solo uno nuevo, los documentos que ya se proporcionaban antes a los donantes para justificar los gastos y la transferencia, por ejemplo, siguen siendo los mismos y entonces no hay mayor cambio a ese nivel.
Nous nous assurons que les commerçants et les bénéficiaires, hommes et femmes, respectent les mesures de distanciation et de désinfection des mains pendant les achats et imposions que pas plus de 5 personnes n'aient accès au même endroit et au même moment. Nous impliquons les commerçants et les organisations locales. Nous menons des visites de terrain à travers les partenaires et les organisations à base communautaire pour le suivi et le respect des consignes édictées par l'Organisation mondiale de la santé et le gouvernement.
Great. We have carried out the following specific activities for meeting social distancing and safety requirements. First, orientation to data center was provided in a telephone. Second, data collection guideline was shared to data centers that emphasizes the need for social distancing and safety requirement. Third, our data senders were able to collect the phone number of at least 5 vendors for each market by explaining purpose and building a rapport. Just before earlier a week, the first COVID-19 case was reported in Ethiopia. This helped a lot to have a reliable vendor contact information to be able to shift to a phone-based data collection system once COVID-19 movement restrictions and risks increased. For the data centers have been carrying out a weekly data collection, a telephone interview, and they are transferring data electronically to CRS for data analysis and cleaning. Thank you.
The market functionality index typically has 9 dimensions and is done via face-to-face and in the field. On this COVID-19 context, we are gathering the information via telephone calls, and we have trained and are doing following up meetings via teleconference also to the enumerators. Having this assessment done via phone has a challenge, and is the availability and disposition that the store owners might have to tackle that challenge, we are explaining who is doing this assessment and why it's important. We are doing it jointly with the government, so that is a key factor for starting the conversations with the stores. Also, we do have replacements, plenty of replacements for the sample. We have a 30% sample nationwide, so we do have options to have as a replacement. And lastly, we are being flexible on the times we do the calls. Not all the stores are able to respond at the moment we are making the first call, so we ask them what time better suits for them. Might that be the morning, the afternoon, or the evenings?
Challenge 2 builds upon the critical need for programme implementers to protect staff, recipients and vendors by taking steps in line with public health guidance. It's important to train all your organisations and partner staff on social distancing and make sure they are following government guidelines and advice. Do what you can remotely to avoid face-to-face as much as possible. Ensure that vendors and recipients are following WHO and Ministry of Health guidelines in terms of social distancing and hand sanitisation when buying items, such as not having more than 5 customers in a shop at one time or providing hand sanitisers in shops. In summary, the impact of COVID-19 on market assessment and monitoring has been substantial through valuable adaptations that have been adopted around the world. Thank you for watching this video. We hope that you found it useful. Please use the comment section at the bottom of the page to give any solutions which you have implemented. We will be producing a number of these videos to provide you with quick takeaways on different themes. If you are facing a particular challenge, please also add this to the comment section on the page and we will do our best to support you. Thank you for watching, thank you for your work, and stay safe.